Coping with Sensory Processing Disorder in Children, written by Dr. Dale Pheragh, and narrated by Micheal Borge. Introduction. Does your son or daughter exhibit sensory processing disorder? Sensory processing disorder is a disorder where the brain has trouble getting and giving an answer to information that comes in through the senses. Formerly known as sensory integration dysfunction, isn't currently named a definite medical diagnosis. This is a groundbreaking book that explains sensory processing disorder, SPD, presents a drug-free approach that provides expect parents. Over-responsivity or under-responsivity to touch or movement. A kid with SPD could be a sensory avoider, withdrawing from touch, refusing to wear certain clothing, avoiding active games, or he might be considered a sensory disregarder, needing a jump to begin to obtain moving. Over-responsivity or under-responsivity to sounds, sights, tastes, or smell. She may cover her ears or eyes, be considered a picky eater, or seem oblivious to sensory cues. Cravings for sensation. The sensory craver never gets enough of certain sensations, e.g. messy fun, spicy food, noisy action, perpetual movement. Poor sensory discrimination. She might not sense the difference between objects or experiences, unaware of what she's holding unless she looks and struggling to sense when she's falling or how exactly to catch herself. Usually high or low activity level. The kid could be constantly around the go, wearing out everyone around him, or moves slowly and get tired easily, showing little desire for the world. Issues with posture, emotion, and coordination. He might slouch, move awkwardly, seem careless, or accident-prone. These are usually the first hints to sensory processing disorder. A common but frequently misdiagnosed problem where the central nervous system misinterprets messages from your senses. Some individuals with sensory processing disorder are oversensitive to things in their environment. Everyday noises or mind-boggling may hurt. The light touch of the t-shirt may chafe their skin. Others with sensory processing disorder may be uncoordinated, bump into things, be hard to respond or react during play. Sensory processing problems are usually recognized in children. However, they can also affect adults. Sensory processing disorders are generally observed in developmental conditions like autism spectrum disorder. Sensory processing disorder is not just named a standalone disorder. Many experts believe that should change. This book offers comprehensive, clear information for parents and professionals and a drug-free remedy approach for children. Free bonus. Are you passionate about reading and adding new value to yourself? Would you love to get various free and discounted books delivered to your inbox courtesy of Enjoy Publishing House? Get access now or visit enjoy.com book deals. Other books by the same author? Before we proceed, I'd like to thank you for downloading and buying this book. I believe this information will impact your life significantly. Please find below other books I've written. They are meant to be impactful. Allergy and asthma relief. #1 straight-to-point solution for managing asthma attack symptoms, signs, and causes in children and adults. Allergy No More, the concise solution for managing symptoms, signs, and causes of drugs, food, insect, latex, mold, pet, pollen, skin, and dirt allergies for kids and adults. Anxiety and Phobia Crush, summarized approach to combat anxiety and regain your life. Asthma Relief, the summarized fail-proof asthma attack care therapy. Visit the Follow the Author's page and see all other books by the author. Amazon.com, author Dale Pheragh. Chapter 1. Symptoms of sensory processing disorder. Sensory processing disorder may affect one sense, like hearing, touch, or taste. It could influence multiple senses. People can be over or under responsive to things they have problems with. Like many illnesses, the symptoms of sensory control disorder exist on the spectrum. In a few children, for example, the sound of the leaf blower beyond your window could cause them to vomit or dive under the table. They could scream. When handled, they could recoil from the textures of particular foods, but others appear unresponsive to anything around them. They could fail to react to extreme warmth or chills, or even pain. Many children with sensory processing disorder begin as fussy babies who become stressed as they get older. These kids often don't deal well with change. They could frequently toss tantrums or have meltdowns. Many children have symptoms like these every once in a while, but therapists look at it
Sample complete. Ready to continue?